technique of dilatation. If examination with the bulbous bougie reveals an induration in the anterior urethra, which is not promptly ameliorated or cured by irrigations, it should be dilated. If the patient's meatus is sufficiently large, the dilatation should be begun with sounds, and these should be carried to the limit of the meatus. The urethra should be dilated not more than 3 numbers at a given occasion, and the usual precautions as to hexamethylenamine and local antisepsis should be employed. When the first sound is passed, the urethra should be palpated upon it to discover any perceptible infiltrations or minute glandular indurations. And if these are found, they should be gently massaged each time the sound is introduced thereafter until they disappear, or until it becomes evident that they are permanent scars. Sounding should be repeated twice a week, and when the limit of the meatus is reached, dilatation with the Coleman dilator should be begun. In using the dilator, it is often possible to advance much more rapidly than with the sound. The instrument is screwed up gently. One waits a moment and then gently turns the wheel a trifle more. By thus turning intermittently, one gains 2 or 3 numbers with little pain to the patient and without exciting much bleeding. I see no advantage in leaving sounds or dilators in the urethra for more than a few moments after the desired dilatation has been achieved. It is a general rule that bleeding is a sign of too severe dilatation. Yet, if the surface of the urethra is much inflamed, the very introduction of the instrument may cause bleeding. Contraindications to dilatation. While gonococci persist in the urethra, dilatation is dangerous. It may do good, it is more likely to do harm. While the urine contains free pus, even though that pus shows no gonococci, dilatation is still somewhat dangerous and should be undertaken only after every effort to clear the urine of free pus has failed. But when only a very light, purulent cloud remains and the urine shows many shreds, dilatation is likely to be most serviceable and almost free from danger. Yet it is always possible that the dilatation may excite acute prostatitis or epididymitis. These may be avoided, to be sure, by restricting the dilatation to the anterior urethra. Yet the dilatation, to be efficient, must include the posterior urethra, since the bulb and the membranous portion are likely to be the regions most in need of stretching. The sensitiveness to dilatation may be overcome by the use of local anesthesia.